Let's just...
Okay, so I have said, sorry,
It's okay to even...
listening to Brene on podcast, I didn't think it would keep playing, that I was going to hop on here and do an Instagram live just to share a little bit of information about what we know about coronavirus, COVID-19, and pregnancy and breastfeeding. So first off, I'm in my car because that is the quietest place I can find these days because I have 3 young children and they are home all the time, which is great, but loud. So I am, for those of you who don't know me, I'm Dr. Sarah. I am a family physician and I do maternity care. And my colleague Dr. Elish and I have started this community to share evidence-based information for women. And a particular area of interest of ours is pregnancy. So when we're talking about coronavirus, COVID-19, I think important thing is to understand exactly what it is. So coronavirus is the virus, the actual bug, basically, that's causing this infection. And COVID-19 is the disease that this strain of coronavirus is causing. Coronaviruses are very common. They cause a lot of the common colds like coronavirus, adenovirus. This strain that's causing COVID-19 is new to humans, and that's why it's just sweeping the world in this pandemic, because we have no immunity to it. So it spreads easily. It's not as infective as other diseases like measles, which we fortunately have a vaccine against, but it's infective enough, and because we have no immunity to it yet, that it's spreading really quickly. So what about COVID-19 if you're pregnant? We know from the limited information that we have, now this disease has only been around, COVID-19 has only been around since the last, I think December 19th or something like that was when the first case was discovered. So all the information that we have is really new and not based on huge numbers. And remember that when we're looking at this information and we're looking at the literature that's out there, and that's what we call studies that are published and where we get our information from, that they're published really quickly. So take all the information that we have, understanding that it is limited. But what we know is that pregnant women, fortunately, do not seem to be more adversely affected than non-pregnant women. So what I tell my patients is that your pregnant self is at no higher risk or no more likely to get significant or severe disease than your non-pregnant self would be. So that's really reassuring. But we remember to tell everyone to continue to practice social distancing, so maintaining a distance of at least 2 meters, practice really good and diligent hand washing, and just be mindful, right? So pregnant women do not seem to be more adversely affected. Great news. What about your baby? So there's concern that if you get coronavirus, that you'll pass it on to your baby. That does, again, not seem to be the case. So we know that the placenta, that is the barrier and what all the blood passes through from mom to baby, can act like not only a physical barrier, but also what we call an immunological barrier. Not all viruses can pass through. For example, when a woman has HIV, her baby is not born with HIV. Coronavirus COVID-19 seems to be the same. So there's zero evidence of what we call vertical transmission. So that means that there's no evidence that a mom who's infected passes this disease on to her baby. There's a few cases where some newborns have tested positive, but that's thought that they actually acquired it from their moms after they were born. And I just also recently learned that there's been some small studies that have done actually swabs in the vagina, and there's been no evidence of COVID-19 being present in vaginal secretions. So that's great. No evidence that if you get COVID-19 that your baby's going to get it. So what about breastfeeding? So if you are pregnant and you have your baby while you are infected with COVID-19, we still encourage that you breastfeed unless you're actually too unwell not to. So if you have sort of mild, what we call URI, upper respiratory tract infections symptoms, you're still safe to breastfeed, and we would actually encourage you to do so. We know how important that skin to skin and bonding and breastfeeding and breast milk is for the baby. So what we would recommend is that you wear a mask always when you're around your baby and when you're breastfeeding your baby, and that you practice really diligent hand washing, but we'd actually continue to support and encourage you to breastfeed. If you're too unwell or too sick to breastfeed, you're still able to pump, that's okay too, and we would support that. So we would just, again, be really mindful that you're diligent with your hand washing and really cleaning the pump parts well, and that's someone who's not unwell. is going to be feeding that baby. So those seem to be the biggest questions we're getting right now with coronavirus and pregnancy. Another common question we have is for women who are in the healthcare sector and are working directly with patients who potentially have COVID-19. They either tested positive or they're what we call person under investigation. We don't have, so I'm in Canada right now as of today, not that I've seen, we don't have any specific guidelines around this from our governing body, the SOGC, the Society of Obstetricians and Gynecologists of Canada, but the RCOG, the Royal College of Obstetricians and Gynecologists in the UK, has recommended that for all pregnant women 20 weeks and above, that they do not work with any COVID positive or persons under investigation. So that's been the recommendations that I've been making to my friends and colleagues. Another question that we've been getting is, okay, well, I'm pregnant, I have my newborn baby, I'm now home, and people are wanting to bring me food. What am I supposed to do? Well, as far as we can tell, coronavirus does not seem to really be transferred through food. So this is a decision you're going to have to make, with your partner and figure out. It's really hard and has to be individualized. I think that if you are certain that whoever's preparing the food from you has been doing their part socially distancing, being diligent with their hand washing, that if they do prepare any food, that you're wiping down containers or you're wiping down the grocery bins that they're leaving for you on your porch, I think that would be reasonable. But again, you could just ask them, perhaps instead of making food for you, buying you a gift certificate to a local business that's doing takeout and delivery. In that way you're avoiding the risk of exposing yourself, and you're also supporting local businesses, which I think is really important for us to be doing right now. Some other questions we've been getting: if I am pregnant, close to delivery, and I do get COVID-19, will that change my mode of delivery? As of now, the answer is no. It has not been recommended that a pregnant woman being infected with COVID-19 is an indication for cesarean delivery. Right now, we would do the routine pregnancy and delivery care, and if there was an obstetrical reason for a cesarean section, that would be undertaken, but not just because of COVID-19. I'm trying to think. There had been a few other questions that I've been asked. So if you get coronavirus, COVID-19 earlier in pregnancy, typically what we would say is just monitor your symptoms at home. For women who have mild symptoms, a low-grade fever and a bit of a cough, we would get them to, socially distance themselves, self-isolate at home, and monitor their symptoms really closely. And then we would get them to return to care once they're symptom-free. And then after that, there has been possibly some evidence of some smaller, slower growth in these babies. We're not really clear the mechanism why that's happening, but once this woman is well and no longer symptomatic with her COVID-19 infection, they will come and get regular growth ultrasounds. And that's not something that we've had to do yet here in Victoria, but that is something, one of my best friends just joined, that is recommended. And I think those are all the questions that I had been asked. So, basically, coronavirus, COVID-19 does not seem to adversely affect pregnant women. You are no more likely to get a serious illness being pregnant than you would be as your non-pregnant self. But we do know that you are still at risk, like the same general population, of developing a serious illness. So we do need to take this seriously. No evidence of vertical transmission. We still encourage breastfeeding. We're still encouraging rooming in here. So meaning mom and baby are in the same room together. If you have any questions or specific questions pertaining to your pregnancy, again, this is just general advice and information, then you should definitely talk to your care provider. So I hope you guys found this helpful, and we'll save this. I will publish it on our Facebook page, as well as our YouTube page, if I can figure out how to save this. Okay, thanks for watching, everybody. Take good care.